and welcome to 20-Minute Health Talk. I'm Sandra Lindsay. I am so excited to have you with us today for a very special, very cute edition of the podcast. As we look ahead to 2025, New Year's resolutions are on everyone's minds. But instead of turning to our usual experts for advice, we'll hear from a group of creative, bright, and most of all, very honest kids. These wise voices were featured in a recent Northwell Health commercial, sharing what they think their parents' New Year's resolution should be. And joining us in studio to provide some perspective on these nuggets of wisdom is Dr. Jaclene Jason, a clinical psychologist and senior director of operations within behavioral health at South Oaks Hospital, part of Northwell Health. Dr. Jason, welcome to 20-Minute Health Talk.
Thank you for having me. Happy holidays.
Happy holidays to you too. All right. Well, this commercial, which is called Little Wisdom, such a cute and clever name, began airing this week. And we're excited to share it with our audience and with you, Dr. Jason. So let's hit play on this commercial titled Little Wisdom.
How can grown-ups be happier in 2025?
Push all the elevator buttons.
Cast spells like a wizard.
Make a million friends. Cupcakes. Frosting. Do not eat dirt. Have a sleepover. You'll enjoy it. Be messy. Like me. Have some fun. Jump up and down. It's part of life. Happier people just live longer. Northwell Raise Health.
Aren't they fantastic?
Adorable.
That's a lot of wisdom right there, right?
Absolutely.
So, once we at 20-Minute Health Talk heard this group, we wanted to see what other little wisdom we could glean from these bright young minds. So we dug into the footage to hear what else they had to say about parenting, wellness, and how we can all bring a little bit more joy into our lives in 2025. So we're going to play some of what they had to say and ask you to help us unpack it all. Are you ready for this?
Absolutely.
All right, let's go to our first clip.
How about we stop rushing around?
This really made me smile. So that was Kent, who is 6 years old. Dr. Jason, what does this say to you?
I think and I can't speak for Kent, what I interpret it as is running is fun, not to get somewhere faster.
Okay.
So we could slow down. For me, I slow down by exercising. So I'm slowing down by taking my dog for a run because it slows my day down. It slows my mind down. It allows me to be fully present when I get back home with my children instead of being stuck in whatever that fast forward mode was I was in all day. For myself, recognizing that we're not perfect people. So this is probably the one that I'm the most fallible in. And that it's a constant growth opportunity. So every time we're in that rush again, being able to just take a step back and say, what can I do next time to slow things down? Maybe we're starting earlier. Maybe it's that we're rushing less of the time during the week than we did the week before so that we're making progress without the goal being perfection. There's actually a lot of research growing about kids feeling rushed all the time, leading to anxiety later in life. So there's direct behavioral health consequences to our inclination to rush.
Amazing. Let's roll to our next clip.
Make a friend with the monster under your bed.
Oh, wow. That was Abby. Abby's 8 years old. And when I hear monster, I hear fear. So what are your perspectives on Abby's advice?
Abby is a wise little girl. We actually teach this a lot in the area of psychology for children all through adulthood. I think what Abby's pointing to is that we all have these fears, to your point. We all have these things that are scary that we're anticipating or imagining in our future. And sometimes the instinct when we have those fears is to avoid them, to run away from them, to hide from them. And to Abby's point, if we can make friends with them, if we can find a place for them, if they could sit alongside us, if we could find purpose in them, then we get to keep navigating through life despite our fears instead of letting fear guide our decisions. And that really shifts our focus away from avoiding any discomfort and fear towards being able to move towards our values in life despite our fears. And kids just are such beautiful examples of some things that we, for whatever reason, forget as we get older some of the time, and regrounding us in those principles. My son reads this book series about the monster under the bed, and there's all these different monsters and they all have different personalities, and they find the children that need those pieces of that monster to help them feel protected or soothed or excited, whatever that child's needs. That's the monster that's under their specific bed. And I just love that because we get to kind of shift this idea of fear being negative to maybe there's something there that we need to explore or move through or overcome to keep moving together towards what we want our lives to look like. So I think Abby worded it perfectly.
So what I'm hearing, we shouldn't tell our children that, there are no monsters under your bed. What are you talking about? This is ridiculous.
Absolutely. There's a balance, right? So if children are fearful of things that need education around it, we want to provide that education. Saying, no, that's not true is different than saying this is actually what the science says, or this is what is going on in the world, or this is what, researching things, reading books, things that educate to help fill gaps. Because sometimes anxiety, which is separate from fear, sometimes anxieties come from not knowing things. Some of the anxiety intensity is lower if we understand what the problem actually is in front of us. The other piece that you're mentioning in terms of just not saying, no, don't be fearful, is we want to validate and honor what our children are experiencing. So there's this idea that these different pieces can both be true at the same time of someone's experience. So I'll use my daughter as an example. When she's doing something, she'll say, oh, it's too hard. And I try very hard not to say, no, it's not hard. Instead, the language that I choose to use is, yes, it's hard and you can do hard things. Allowing our children to build self-efficacy instead of self-doubt, that when they're feeling fear that they're doing something wrong is the message we're underlying when we're saying, no, you shouldn't be afraid. There's nothing to worry about. Pivoting it to validating and helping them to build that autonomy to know that they actually are capable of doing things when they're scared really helps to support just confidence and diving into your life differently.
Amazing. Because as adults, we have adult monsters as well, which can manifest in self-doubt, lack of confidence, fears, and anxieties.
Absolutely.
Right?
And that definitely can present itself in parenting. So every parent has yelled at their children. We're not perfect. And when we talk about that fear and that self-doubt popping in, there's a lot of judgment and blame that comes up. So if we're having a hard day, if we're stressed, if it's the holiday season and we're trying to balance, working and parenting and having all the presents ready and getting places on time and all of those things, any small thing from our children might set us off. So our ability to take a step back and work through that fear of I'm a bad parent, that self-doubt of I'm doing something wrong, I mess up my kid forever, all of those things that might come up for the parents in the situation to be able to take a step back and say, I'm just noticing those thoughts. And what I actually can do is something actionable about this. I can let go of the attachment to those thoughts and I can go speak to my child and use it as a way to connect. And then it teaches that we're all fallible. And how do we navigate these conversations together? By saying, I was stressed out. Next time I'm feeling stressed out, I'm going to take a deep breath before I respond, whatever that looks like. And then we're modeling that it's okay to error and it's okay to learn and grow, and that we can have those conversations with our children and it supports them in having those outlets themselves.
So I love that. It's such a great way for parents to model problem solving with their children, talking to their children instead of shying away from those conversations and really beating themselves up. I wish I met you before I started having children. Now, let's hear from Sophie, a 6-year-old with a big imagination.
Life is about activities. Life is about fun. Be explorers. Learn new things.
climb a mountain, climb a bridge, make a language up.
Oh, wow.
Amazing.
Life is about activities. Life is about fun. I agree with you, Sophie. Dr. Jason, I know I like that advice. What about you?
Absolutely. And again, these children are saying things that are grounded in research, even though they're not aware of it at this age. There's a lot of support around the exploration and learning of things, helping us as we age cognitively stay intact. There's a lot of information about even at younger ages, the more we're exposed to and experience and explore and build upon, that our brain forms a lot of connections and new connections, and that just continuously helps us to problem solve. And it also reminds me of James Patterson talks about with parenting, the importance of allowing them to take risks and get into situations that we might see as dangerous safely. He talks about, maintaining safety and letting children navigate their world in a way that helps them to put themselves in situations that maybe do cause some amount of uncomfort, especially for the guardians.
Yeah.
The potential for them to fall down physically and metaphorically, get up, brush themselves back off, learn from it, and keep moving on is something that we as parents have to tolerate, and so helpful and important for their growth. So our intention is to both protect and build an independent adult one day. So balancing that, we get to decide where the line is.
Okay, and let's hear from Abby one more time.
Cartoons are for weekends.
All right, Dr. Jason, what can we make of this?
So funny. I'm just thinking of a conversation I had with my kids this morning. Like I said earlier, the goal isn't to have fun all of the time. The goal is that we have structure around fun time. So if homework isn't done, we don't want to be having a dance party in that moment. Or maybe we do for 5 minutes because we need to get the sillies out so that we could sit down and do homework. Again, it's individual to the family, the system, the child, the parent, what is needed in that moment. We just have to be mindful of putting things in the right place so that we're not reinforcing avoidance of things that are necessary. Again, avoidance of doing hard things or things that we might be fearful of or things we just don't want to do or find boring. We could pivot to putting structure around that these things are earned. There's a time and place for it. There's limitations around it. And also that we can mirror and model those things as well.
Awesome. So now let's close it out with another advice from our friend Sophie.
It's okay to be happy for no reason at all.
I completely agree with that. We have a choice. If we want to be happy or want to be sad, why not choose happiness all the time?
Absolutely. And I think it also comes down to, we do make these choices and there's events in our lives that are going to move us away from that. And there's times of year, the holidays being one of them for a lot of people, that can be triggering. What children do exceptionally well sometimes, and that we fall out of the habit of, is understanding that we could have these conflicting emotions go on at the same time. When we have these stressful times, we can also find these moments of joy, and it doesn't take away from whatever else we're going through. We could fully engage with our kids and be stressed about work. We could fully play in the moment and be sad about, a memory of a holiday that we don't have anymore. Whatever those things are, having the ability to still incorporate the joy and choosing that.
And I think as parents, though, we all want to be perfectionists. We all want to be perfect for kids. So how do we kind of get over that? And
great point. I was thinking in the commercial when they said make a mess, and we're talking about this play. In my house, my children, and I'm sure this is not unique, love making forts. And my husband is an excellent fort builder, and he has a lot of fun with them. And sometimes my instinct is I just put all the furniture away. This house was spotless 10 minutes ago. How many times do I have to fold up the sheet to make this house look like a house again? So I think our inclination of what perfect looks like gets in the way sometimes, definitely for me, of fully being in the moment of fun. Like for me, I have to constantly check myself and be like, it's not going to be a mess forever. One day this house is going to be spotless and I'm going to be so sad about it. So in this moment, how do I allow play and embrace play. And again, I'm not perfect about this. No one's going to be perfect about it. Sometimes what I say out loud is, I just cleaned this room. And other times I can say, cool tent. So I have to reflect on what's getting in the way for me in those moments so that I could more of the time show up and allow tents to be built, because they're children and tents are cool and we should allow tents to be built. And I'm guilty of not always allowing tents to be built.
Can we talk about happiness in the general sense and the ability to be happy?
Absolutely. There's a book that they should start paying me because I've recommended it so many times. It's called The Happiness Trap. What it speaks about is this illusion that we're supposed to be happy. The difference in finding joy and satisfaction in things and feeling happy all of the time are very separate things. So we are not meant to be happy all of the time. We are meant to be able to build a life that's meaningful and find joy and purpose in those activities, those people, those relationships, that life, even when we are not feeling happy. So translating Sophie's language of happiness into what we know in terms of satisfaction or purpose or meaning, we can find purpose in anything in everyday life. That being said, for some people, it is a larger issue. There's people both biologically and from what they've been through that struggle differently. Especially, I work in behavioral health. There are people that have clinical diagnoses of anxiety, depression, other types of mental health disorders that treatment is really necessary to be able to move towards that life of purpose and meaning. So there's resources that are available. Northwell has a great amount of resources for children, adolescents, through adulthood, specifically around behavioral health, because sometimes we do need different types of support, different types of psychotherapeutic interventions to be able to get to a place where we can keep building that purposeful, meaningful life and navigate the times that we really aren't feeling so happy.
Can you dig a little bit deeper into these programs? Are they only for children? Do you have programs for adults as well?
Absolutely. So in terms of services, we have services across the lifespan from children through adulthood with different areas of struggling within behavioral health, whether it's mental health related or substance use related. Me specifically, I work at South Oaks Hospital, and some of the resources that we have there for children and adolescents are we have a full clinic program for children. And we're seeing younger children that have some needs in terms of understanding those behavioral principles, and parents that in understanding some of those behavioral principles of how do we frame play, of how do we have fun in a way that's helpful and productive in terms of promoting healthy pro-social behavior. So we have programs that help to structure that for the family unit. We also work with adolescents who might be struggling with different types of emotion regulation issues or feelings of anxiety or depression, or early substance use. We also are seeing an increased need in general with children and adolescents across New York. And because of that, we're in the process right now of opening a program in Riverhead that will have those same services as well, so that we can serve people that are further east that might not otherwise have had access to some of these resources. We also have services in Ducker Hillside Hospital, which is closer to the Queens area, and a few other locations across Northwell.
Amazing. So parents, for 2025, let's give ourselves grace. Let's go for progress, not perfection. Dr. Jason, thank you so much for helping us unpack all of this wonderful little wisdom. As we've seen today, kids truly do have a lot to teach us about our health, happiness, parenting, and just how to live in general. And so to all our listeners, we wish you a happy, healthy start to 2025. This has been another episode of 20 Minute Health Talk. Until next time, take good care.